Archer vs. NCSBN, which NCLEX practice questions are actually better? Question 1. The nurse is assisting the physician with the removal of a central venous catheter. To facilitate removal, the nurse should instruct the client to: Option A. Perform the Valsalva maneuver as the catheter is advanced. Option B. Turn his head to the left side and hyperextend the neck. Option C. Take slow deep breaths as the catheter is removed. Option D. Turn his head to the right while maintaining a sniffing position. The correct answer is option A. Perform the Valsalva maneuver as the catheter is advanced. Performing the Valsalva maneuver increases intrathoracic pressure, which absolutely prevents air from being sucked into the vein and causing a fatal air embolism. Question 2. A client is discharged home with a prescription for sodium warfarin. The client should be instructed to: Option A. Have a ProTime done monthly. Option B. Eat more fruits and vegetables. Option C. Drink more liquids. Option D. Avoid crowds. The correct answer is option A. Have a ProTime done monthly. Warfarin has a narrow therapeutic index. Patients require frequent, regular prothrombin time, patient, and INR blood tests to adjust the dosage and prevent life-threatening bleeding. Question 3. The physician has ordered a minimal bacteria diet for a client with neutropenia. The client should be taught to avoid eating: Option A. Packaged fruits. Option B. Salt. Option C. Fresh raw pepper. Option D. Ketchup. The correct answer is option C. Fresh raw pepper. Fresh, raw vegetables and unpasteurized spices like raw black pepper carry high amounts of environmental bacteria and fungi, which are dangerous for a neutropenic patient. Question 4. A client with cancer of the pancreas has undergone a Whipple procedure. The nurse is aware that during the Whipple procedure the doctor will remove the: Option A. Head of the pancreas. Option B. The proximal third section of the small intestines. Option C. Stomach and duodenum. Option D. The esophagus and jejunum. The correct answer is option A. Head of the pancreas. A standard pancreaticoduodenectomy, Whipple procedure, involves the surgical removal of the head of the pancreas, the duodenum, the gallbladder, and the bile duct. Question 5. A client who is admitted with an above-the-knee amputation tells the nurse that his foot hurts and itches. Which response by the nurse indicates an understanding of phantom limb pain? Option A. The pain will go away in a few days. Option B. The pain is due to peripheral nervous system interruptions. Option C. The pain is psychological because your foot is no longer there. Option D. The pain and itching are due to the infection you had before the surgery. The correct answer is option B. The pain is due to peripheral nervous system interruptions. Phantom limb pain is a very real neurological phenomenon caused by the severing of peripheral nerve pathways, sending confused signals to the brain. Question 6. A client hospitalized with methicillin-resistant Staphylococcus aureus is placed on contact precautions. Which statement is true regarding precautions for infections spread by contact? Option A. The client should be placed in a room with negative pressure. Option B. Infection requires close contact, therefore the door may remain open. Option C. Transmission is highly likely, so the client should wear a mask at all times. Option D. Infection is prevented by hand washing, gloves, and a gown. The correct answer is option D. Infection is prevented by hand washing, gloves, and a gown. Contact precautions require the use of standard personal protective equipment, gloves and gowns, to prevent the physical transfer of microorganisms from skin or surfaces. Question 7. During a home visit, a client with acquired immunodeficiency syndrome tells the nurse that he has been exposed to measles. Which action by the nurse is most appropriate? Option A. Administer an antibiotic. Option B. Contact the physician for an order for immune globulin. Option C. Administer an antiviral. Option D. tell the client that he should remain in isolation for 2 weeks. The correct answer is option B. Contact the physician for an order for immune globulin. Immunocompromised patients cannot mount a response to a vaccine, so they must be given preformed antibodies, immune globulin, immediately after exposure for passive immunity. Question 8. A client recently started on hemodialysis wants to know how the dialysis will take the place of his kidneys. The nurse's response is based on the knowledge that hemodialysis works by option A, passing water through a dialysing membrane. Option B, eliminating plasma proteins from the blood. Option C, lowering the pH by removing non-volatile acids. Option D, filtering waste through a dialysing membrane. The correct answer is option D, filtering waste through a dialysing membrane. Hemodialysis relies on osmosis and diffusion to pull toxic waste products and excess fluid from the blood across a semi-permeable dialysing membrane. Question 9. The primary reason for rapid continuous revarming of the area affected by frostbite is to option A, lessen the amount of cellular damage. Option B, prevent the formation of blisters. Option C, promote movement. Option D, prevent pain and discomfort. The correct answer is option A, lessen the amount of cellular damage. Rapid, continuous revarming in a warm water bath halts the freezing process instantly, preventing further tissue necrosis and minimizing permanent cellular damage. Question 10. A client with a clotting disorder has an order to continue enoxaparin injections after discharge. The nurse should teach the client that enoxaparin should option A, be injected into the deltoid muscle. Option B, be injected into the abdomen. Option C, be aspirated after the injection. Option D, be cleared of air from the syringe before injections. The correct answer is option B, be injected into the abdomen. Enoxaparin, Lovenox, is a low-molecular weight heparin that must be administered strictly via deep subcutaneous injection into the fatty tissue of the abdomen. Question 11. The nurse is monitoring a client with a history of stillborn infants. The nurse is aware that a non-stress test can be ordered for this client to option A, determine lung maturity. Option B, measure the fetal activity. Option C, show the effect of contractions on fetal heart rate. Option D, measure the well-being of the fetus. The correct answer is option D, measure the well-being of the fetus. A non-stress test is a non-invasive monitor of the fetal heart rate in response to fetal movement, universally used as a primary indicator of fetal well-being. Question 12. A toddler is admitted with a cardiac anomaly. The nurse is aware that the infant with a ventricular septal defect will option A, tire easily. Option B, grow normally. Option C, need more calories. Option D, be more susceptible to viral infections. The correct answer is option A, tire easily. A ventricular septal defect forces oxygenated blood back into the lungs, increasing cardiac workload and causing the infant to tire very easily, especially during feeding. Question 13. The infant is admitted to the unit with tetralogy of Fallot. The nurse would anticipate an order for which medication? Option A, digoxin. Option B, epinephrine. Option C, aminophylline. Option D, atropine. The correct answer is option A, digoxin. Digoxin is a cardiac glycoside that increases the force of myocardial contraction while slowing the heart rate, improving overall cardiac efficiency in structural heart defects. Question 14. The nurse is monitoring a client following a lung resection. The hourly output from the chest tube was 300 milliliters. The nurse should give priority to option A, turning the client to the left side. Option B, milking the tube to ensure patency. Option C, slowing the intravenous infusion. Option D, notifying the physician. The correct answer is option D, notifying the physician. Chest tube drainage exceeding 100 milliliters per hour is abnormal and indicates active surgical hemorrhage, requiring immediate notification of the surgeon.